Good morning, or good afternoon, or good evening, depending on what time you're watching this. Very quick check-in today, just to say, and this may be very obvious, and it may not really apply to most people who are watching this, but there are sometimes some people who, for whatever reason, this dental sleep medicine just simply doesn't fit into their practices. I know that may also be true of their belief systems, but for the sake of this conversation, monologue, then we'll just assume that people are either very busy or very busy doing other things, and the practices are not set up for dental sleep medicine. So what are you going to do? Because having been in practice for some years, and in a general practice, it's rather difficult to simply say, actually, I don't do that. We don't have specialists, but I can send you to a guy down the road, or lady. And the problem with that is that as dentistry changes, as those that are in dentistry, have been in dentistry for any length of time, will see very plainly, while perhaps those that haven't been in dentistry for so long won't yet. But we're going through a change, and we are going not necessarily for the better, costs and pressures, the need to protect your own practice, corporates, the list goes on. And so we have to, it's a bit like driving, you have to drive defensively. So the reason that I mention that is because what are you going to do? If you don't particularly want to do endodontics, you send your patient to an endodontist. You may have a friend who does implants. We don't have specialty for that. But normally it's in association with the work that you're going to do. Well, that works best. Oral surgery, taking wisdom teeth out, okay, that's pretty obvious. Orthodontist, if you're going to have a child or adult wants their teeth straightened. I know there are a lot of other things on the market now, but let's just, for traditional, from a traditional standpoint. But it's rather difficult with dental sleep medicine, because you are referring to another general dentist, even if they do, the majority of their work is sleep and TMD. Nonetheless, they are still a general dentist, and we all know that sometimes, I'm sure not you, but sometimes we refer to people and when we don't get the patient back. And now that doesn't make any sense in the long term, but unfortunately we live in an era, an age of instant gratification, and long-term consequences don't seem to make as much difference now as they did when I was a kid anyway, and certainly not when I started practice, and certainly not when I ran a big general practice. So what do you do? Well, the reason I've said what do you do a number of times is because it's not always that easy a question to answer. I think the only solution, like it or not, because it does mean a bit of involvement from you, is, you have a choice. You can either ignore the problem completely, but that's at the peril of your patients. I won't talk about medico-legal aspects, but we'll just talk about ethical aspects, and ethically it's probably not the right thing to do. So that's doing one thing. It's like all consents, doing nothing is always one option. Second option is to refer out. And if you have somebody who's close by that you have a good relationship with, who you know you're going to get your patient back from, and you know that they know enough about it that they'll kind of get the timing right with your treatment, and you have the relationship where they will continue to support you by doing the adjustments, so you don't have to get involved in all the frustrating, because that's what it is sometimes, and less productive work, less profitable. And so that's the second option. The third option, of course, is to bring somebody in who does it, performs those services within your practice. And you may or may not have time to do that, and you may not have the space to do that. You may not have the desire to do that, because once again, then you're looking at more commitment. The other thing is to have someone who, within your practice, if it's a general practice, to have somebody do all the work for you apart from those bits that you have to do, and just pick a time when, well, it's a bit like doing checkups. You know, in a perfect world you wouldn't do it this way, but most people do flip from one chair to another, and it's not ideal, and I've done it both ways, but sometimes the pressure of work, the pressure of size of your practice and so on and so forth does dictate that you do that. And equally, that's also true of relatively small procedures, and maybe taking the bite will be one of them. Maybe you've scanned the person's teeth, well, not you, but maybe a member of your team has scanned patients' teeth or taken impressions. Everything's ready to go. They've taken the photographs, they've done the initial run through for the exam, so it's just a matter of you checking everything, confirming everything, and then you're there to take the bite. And I know that there are lots of dentists, I'm in Canada, but a lot of dentists in the States, and I'm pretty sure, although I don't know this for a fact, that there are probably dentists here who have their team members take the bites. I just have a bit of an issue with that, but that's maybe my problem. Anyway, that's by the by. You must decide that for yourself. And but that may be an option too. But I think you have to sit down and think about it, because it's not one of those problems that when you ignore it just goes away. It is part of your practice. It is part of your responsibilities, our responsibilities, somewhere along the line. So with that, I'll leave you with more problems than you came with. But I think it's worthy of consideration. As far as other people are concerned, well, if you really enjoy doing it, then you can reach out to other practitioners, making clear that you will return their patients to them. Whether or not they believe you, of course, is neither here nor there. And sometimes it's difficult because patients actually prefer you. And I was in a very difficult position once, I'll just end on this, that I worked in a sleep clinic for a while. And you know, I have qualifications in dental sleep medicine, and so that was great for physicians, because physicians would refer to the medical sleep lab. But when we did oral appliances, I would always give the option to the patient of going to their dentist if they did them, and some did, and very frequently they didn't. And you know, you can't say, well, I refuse to see you. Well, I suppose you could do that, but then I wouldn't have been at the sleep clinic very long. And so it was a difficult situation to be in, and in the end the pressures mounted, and well, anyway, what happened in the end is that the sleep lab got such stick from the general practitioners that it was determined that providing CPAP was the better way to go, so that was me out anyway, so that was fine. Well, it wasn't fine, but it was the way it was. And so, yeah, politically there are a lot of difficulties, but what are you going to do? You can only do the best you can. So, no particular words of wisdom there. You know, I think you have to balance things up on your you know, in your own life and to your own facilities, preferences, but just try not to ignore the problem, because it won't go away. In fact, it'll get worse, because not only do people get iller when they have it, but there's more and more awareness. I know it's slow, it's painfully, gruelingly, painfully slow, but it's slowly coming, and we just can't see the wood for the trees. And as I've said in past monologues, you know, if we don't do it, someone's going to take this off our hands, and when they do that, that will be the beginning of the end, because dental sleep medicine has such far-reaching ramifications into general dentistry. It's the only warning I'm giving, but that is a warning, and I've seen it happen. As a dentist of many years, I've seen it happen in other disciplines. I would suggest that we do not do that. Anyway, there we are. Enough misery from me, and I'll catch you in the future, probably tomorrow.